Dr. Landon Pryor here with our breast implant illness patient advocate and hero, Angel Laura Bowden. We just wanted to put out a statement briefly based on some of the communication that's come out of the FDA and ASPS, as well as some of the implant manufacturers. I'm sure people have seen or will be seeing some information about it in the upcoming days and weeks. This was just released. The FDA just released new findings related to breast implant associated squamous cell carcinoma. We've known already that there is breast implant associated ALCL, which is anaplastic large cell lymphoma. That was kind of the last scare, over a year ago at this point, that prompted a lot of further investigations into the correlation between implants and any potential other issues that potentially could be derived from the implants, and that potentially, in my opinion, could be correlated with breast implant illness. But at this point, all we know is that based on this new communication from the FDA, there have been 16 cases reported of this BIA, breast implant associated squamous cell carcinoma, which is still, obviously an extremely rare cancer, but the finding is that it is included in the capsules around the implant. So similar to the breast implant associated ALCL, the new recommendation, of course, is that any suspicious implants that develop any kind of pain or fluid around the implants should be tested and potentially removed with, of course, an en bloc capsulectomy to further confirm the diagnosis of any potential occult cancers that are found in the capsules around the implants. We always do en bloc capsulectomies anyway for patients that are coming to see us related to breast implant illness, which is a totally separate topic, but I think it's worth mentioning. I don't think that this is something that people need to go out and panic about and get their implants out because they're afraid that there could be cancer hidden in the capsules. I think this is kind of consistent with what we've heard previously, which is there is a possibility of a cancer forming in the capsule around the implant. The etiology or cause is still unknown. The incidence is not fully reported, so we don't really know exactly how common that is. But just again, to kind of raise awareness that there are these potential issues with breast implants. And of course, if you have any concerns or suspicions related to something concerning happening with your breast implants, you want to go and see somebody that's experienced with these types of conditions, and of course taking out the implants the right way with the en bloc capsulectomy, not only to make sure that we can resolve any potential symptoms related to either BII and or any kind of potential carcinoma hidden in the capsule, but also minimize the risk for recurrence. That was actually something that came out with the recent FDA statement. So again, they're advocating for en bloc capsulectomy for any potential cases of BIA ALCL or BIA SCC squamous cell carcinoma, which is a new communication from the FDA related to finding in 16 capsules found on pathology. Thoughts on that, Laura? And Laura's actually very involved with this. She was on a call last night with probably about 20 other professionals, both in the industry and tied to FDA, to just make sure that we do our job to raise awareness to the community and to prospective patients that have breast implants. We're all about making sure patients are making an informed decision and the informed consent process, which is definitely the recommendation now coming out of both the FDA and a updated statement from the ASPS, American Society of Plastic Surgeons, of which I'm a member, and they released a statement to their surgeon community today. Thoughts on that?
That's pretty much covered it. It's just basically going back to the importance of an en bloc or total capsulectomy being performed to make sure that everything is being removed and going to a doctor that believes.
Even more reason. Again, I'm not trying to start a panic. I don't think people should be panicked, but I think it does highlight the importance of if you are potentially experiencing symptoms, you need to see somebody that's experienced with breast implant illness and explant surgery to make sure that your concerns are addressed and that potentially you're getting a surgery that's going to solve the problem. And it just, again, brings awareness to the issue that patients that do have breast implants, those aren't without risk. So talk to your doctor to a medical professional that has experience treating patients with breast implant illness or breast implant associated illnesses.
Yeah, excellent. Thank you. We appreciate
Thanks.
you.